Hello and welcome. We've hit the 100 attendee mark, so I think and that's our signal to go ahead and get started. Thank you for joining us today for this Path Live Forum. Today's conversation is called AI and Machine Learning, the Future of Health Data, and it's the first in our series of digital and data discussions. My name is Hallie Goertz. I'm the Director of Engagement for the Center of Digital and Data Excellence at Path, and I'll be moderating today's discussion. So before we start, we have a few logistics. First, we want to hear from you. Please share your questions and comments with us by submitting them in the chat or Q&A box at any time. I will be monitoring your questions with a little help from my friends on the back end, and we're saving time for them at the end. I also invite you to join the conversation online by using the hashtag PathLiveForum, all one word, and tagging us at PathTweets, again, all one word. Also, please know that this call is being recorded and will be distributed for those unable to attend the live stream. Before we start, I want to say a special thank you to Columbia Hospitality and John and Deanna Oppenheimer for their sponsorship support of Path Live Forums. Path is grateful for their partnership and commitment to improving health equity on a global scale. I also want to thank everyone who is joining us from all over the world, 118 and counting, philanthropists, government representatives, corporate partners, and peers. We so appreciate your interest and participation today as we all work together to advance global health. So before we dive into our conversation, I wanted to share a little bit about Path for those of you who may be less familiar. Path is an organization that is dedicated to achieving health equity so all people and communities can thrive. Together, we are driving public health tools and approaches that meet the most pressing needs of families, communities, and countries. Our specialties range across vaccine research and development, diagnostics, drugs, devices, and health systems. We are a global team working in 70 countries around the world, and I am so proud to be part of this organization for the past 6 years. Thank you again for joining us. And now, on to our show. Please join me in welcoming past Chief of Programs and Innovation, Jeff Bernson, for opening remarks.
Thanks, Hallie, and good morning, good afternoon, good evening, everyone. It's an honor to open this webinar. As Hallie mentioned, at Path, our mission is focused on eliminating health barriers, or eliminating barriers to health equity. And over our 40-year history, we've been dedicated to ensuring that health innovations benefit communities that are marginalized or otherwise underserved. And for us, our hypothesis is that health innovation can be a catalyst to leveling a pretty uneven playing field when it comes to health service delivery. So one area of innovation that I'm personally passionate about is the use of digital technologies and, of course, data for decision-making and action. And when you consider that 90% of the world's data was generated just in the last 2 years alone, this demarcates an unprecedented opportunity to unlock the insights, especially for the global public health sector. And for us at Path, these insights can be especially useful in our work with ministries of health, and of course, helping them guide their decisions on whether or not to accept new innovations in health service delivery, whether or not to deploy scarce resources, and ultimately envision service delivery that doesn't leave behind critical pockets of vulnerability. So why are we talking about AI and frontier technologies? For me, this is a critical extension of this newly minted data and digital resources that is especially critical for global public health. As the data we generate grows exponentially, so does this AI health market, which is expected to reach 31 billion by 2025. AI and other frontier technologies could offer new insights and improve health services and uncover new opportunities for innovation and discovery. And some have estimated that AI applications could result in over $150 billion in saved healthcare costs annually. That's just in the US alone. And for us, AI applications are critical for making the invisible visible. So at Path, we work with AI and machine learning to identify vulnerable populations, where they live, using maps and satellite imagery, and understand where these populations live and where they're migrating to. There are other groups, of course, working on cell phone and computer vision solutions that will act as universal diagnostic readers, for example, helping digitize rapid tests at point of use. So the examples are nearly endless, but for me, what's exciting about these examples is that they're no longer limited to groups working in the global north. This is a sector that's being democratized pretty rapidly. So I think about innovation hubs that are leading the way for this digital transformation. I think about initiatives like Data Science Africa or Deep Learning Indaba host conferences and training events. Deep Learning Indaba has chapters in more than 27 countries in the African continent alone. And as we know, also, there's a huge opportunity to leverage the private sector. We have Microsoft here today, but groups like IBM and Microsoft and Google all have established research and development labs and initiatives in places like Nairobi, Johannesburg, and Accra. And then, of course, countries like India are among the world's leaders in AI expertise, which will help define the future of frontier tech. The number of AI professionals in India alone has more than doubled in the last 2 years. And so this is exciting. Frontier technologies also come with great risk. Like any new technology, we hope that these things are used thoughtfully, and we hope that our sector can really be critical in its thinking about how they're applied and understand whether or not we're impacting communities negatively that have been also historically marginalized. So in order to take full advantage, we have to ensure that these technologies don't reinforce historic injustices. So the conversation we're about to have is going to be a really important one. I hope it's a step forward in grounding the advancements of these technologies in health equity, as well as inspiring new avenues of thinking of how we can all benefit from new uses of AI and other frontier tech. So it's a great pleasure to turn back over the moderation to Hallie, who is our Director of Communications and Advocacy at Path Center for Digital and Data Excellence. So back to you, Hallie.
Thanks so much, Jeff. Really appreciate those remarks and really looking forward to the conversation we're about to have. I'm honored to introduce our panel representing deep expertise and diverse perspectives in frontier technologies and their application to health. To begin, Aerts is the head of the Novartis Foundation, which focuses on how digital technology, data science, and AI can reimagine health and care around the world. And amongst many other things, she's an author of the new Broadband Commission report, Reimagining Global Health Through Artificial Intelligence. Anne, thanks for joining us. Geralyn Miller is Senior Director of Health Strategy at Microsoft's AI for Good Research Lab. She works closely with Microsoft's partners to apply AI and machine learning to humanity's biggest challenges, creating a more sustainable and accessible world. In a recent op-ed for Time magazine, Geralyn poses the potential of AI to shift our focus from disease to how we stay healthy. Thanks for being here, Geralyn. And Nanjira Sambuli is a researcher, policy analyst, and advocacy strategist working at the intersection of technology and global governance. She has deep interest in understanding how digital technologies impact societies. Nanjira is a board member of the Digital Impact Alliance and a co-chair of the new Transform Health Coalition, just a few in a lengthy list of global appointments and roles. Thanks so much for joining us, Nanjira. So I really appreciate you all being here today for this conversation. And before we really start, I must say how excited I am to moderate an all-female panel talking about technologies. Through these digital and data conversations, PATH is very committed to elevating voices, as Jeff said, from traditionally underrepresented and marginalized communities. And I'm very happy to welcome all of you, illustrious, accomplished, and brilliant women, this first in our series of digital and data discussions. So let's start by talking about opportunities and challenges for AI and machine learning. And how is frontier data influencing different areas of health innovation like disease monitoring, diagnostics, or self-care? And how can or should this influence be accelerated?
First of all, thank you, Hallie, for the fantastic introduction. It was really it's a real pleasure to be in an all-female panel. Congrats for that. And yeah, I fully agree with Jeff that there's so much going on already. So AI in health is not something of the future anymore, but it's something that already has a real big impact all around the world, not limited to the global north, as Jeff said. And we became aware of that, or we really have the proof now, and we did this global landscape analysis in the frame of our working group from the Broadband Commission for Sustainable Development, and looked at everything that is already having an impact in the field of AI. And I can say we found 5 top use cases. So it's not only about clinical care, where we know that image-based diagnostics for the radiologist, the pathologist, or the dermatologist can be made much more accurate and faster with AI, but we see that there's many other applications as well. First of all, in the population health space, we've seen in the time of the Ebola epidemics, there was UNICEF, for example, with Magic Box developing a system that combined data sets from 90 different sources to help governments better respond to epidemics. And you can imagine how that has proven instrumental now in the response for COVID as well. Another area where we see really a lot of use of AI in health is obviously in research and development. I come from the Novartis Foundation, but my colleagues in the Novartis company have explained to me many, many times how fast you can now discover new therapeutic options much more easily. You can combine data, find new therapeutic targets and molecules that could respond to those, but you can also facilitate a lot how clinical trials are run. So that accelerates the whole development of new medicines. And you know that normally takes a lot of time and has a lot of failure rates. So one beautiful example is now again during COVID, where all the healthcare industry together with Bill Gates in the CEO roundtable put their data together of the existing drugs, looked at what of those existing drugs may have an effect on COVID. And there's a few of those that are now running clinical trials. So that would never have been possible before the AI era. And then obviously the third use case is clinical care. I'm not gonna expand on that. We know all the examples. But the fourth one are the patient-facing solutions. And there we know obviously chatbots, for example. But in China, there's also a fantastic example with Ping An Good Doctor that is massively impactful, already having 300 million users. Ping An is an insurance company, but what they deliver now is to every family, and they want to deliver in China to every family, access to a doctor, access to a health management plan, and to an electronic health record. And they do so through an internet-based, cloud-based internet hospitals, health centers, and pharmacies. They even deliver at home 24/7. So they do an average of 700,000 to 1 million consultations per week, I believe. Now, excuse me if the data are wrong, but it's massive. So that's really a good example of how patient-facing interactions in this new era where we have the power of data and AI is very important. And lastly, the last top use case is how we can optimize the performance of health systems, how we can optimize the processes, not only the back-end processes like supply chain management or workforce planning, but also a lot of other processes that can be automated and deliver time back to the health professionals to spend more interaction with their patients, what they like most. So that is in a nutshell what we found, that there's massive examples in low and middle income countries of how AI is already impacting health and care. And that's the reason why I firmly believe it is the opportunity of today, living in this era where data, digital, and AI has becoming our bread and butter. It is possible now to finally transform health systems from being that reactive system that can only treat a disease when it occurs to become really proactive, predictive, and even preventive health systems, true health systems, keeping populations healthy instead of waiting until people come with an issue. So let's take that advantage as fast as we can and scale these impactful solutions to other geographies. That's how I feel we can all work together best.
Well, I'm inspired. I sort of want to be like, let's pause this conversation so we can all go start working on the scale of frontier technologies. And the reach that you described is really immense and awesome when we start to think about the potential around the use cases and direct care, as well as those back end systems. And one of the things you mentioned, I think, is a perfect seg to go over to Geralyn about moving to a proactive approach to health. And I think, Geralyn, you had mentioned this in your op-ed about how frontier tech really has this potential to move us from a reactive treatment approach to a proactive, how can we focus on health and being healthier approach. So given all that, and from your perspective, what do you see as the most promising health application, and what future applications get you most excited?
Great. Well, first off, thank you for inviting me here today to join this wonderful panel. There's so much to talk about here. We could just go on for probably days. In January of last year, Microsoft announced the AI for Health program. It's a 5-year philanthropic initiative that is going to focus on bringing AI to bear on some of the world's greatest problems in health. We have a very large portfolio of grantees, focusing on everything from global health insights, basic scientific research, and then of course health equity. Including our COVID-19 work, we're roughly over 100 grantees today. And all of these people are really working at the intersection of AI and data science. So, I think the best way to kind of frame this is to talk about a few of these, and then it'll give you kind of a glimmer of what is possible, or what we believe is possible. Coming back to what is happening here and now, we'd be a little bit remiss not to mention something about COVID-19, because it has been the focus for the past 6 months. For COVID-19 specifically, one of the areas where AI really shines is in the ability to help predict resource utilization. So resource utilization has been a huge problem. We see governments around the world balancing this opening up and the economic advantage of that with the need to shut down because of limited number of hospital beds, just the burden on the care system and first responders. So we have a number of active research projects in our portfolio that are focusing at looking at radiographs, so chest X-rays and CTs of people who present with COVID-like symptoms, and then taking all this great imaging data, combining it with other phenotype information, and using this to predict progression of the disease. But predict progression of the disease so that you can get insight into whether or not, for example, this person will need an ICU bed. Will this person eventually end up needing mechanical ventilation? So you can kind of do this balancing act of resource utilization. But there will be an end to COVID. We know that, right? And for that reason, we continue to invest in bringing AI to the underserved demographic. We can't leave that work fall by the wayside. One example of the work that we're doing in this area is with AI for Health partner Aerts. One of the leading causes of preventable blindness globally is diabetic retinopathy. There's roughly 463 million people in the world today that are at risk of blindness due to this. Yet there are only 210 ophthalmologists worldwide. And as you can imagine, those 210 ophthalmologists around the world are not equally distributed across all areas. And so things like AI and AI models can close this gap with up to 97% accuracy, which is on par with ophthalmologists. So an exciting area. Another exciting area, of course, is the area we're doing with the work we're doing with Novartis Foundation on leprosy. Leprosy is one of the oldest diseases in the world, with an estimated 2 to 3 million people living with it today. I won't steal Anne's thunder. I don't know if she's going to talk about this or not, but the work that we're doing here is to create, a discrete mobile screening solution so that people can get a sense of whether or not they need a referral to get an appropriate diagnosis. So this is another example of trying to reach that, the most marginalized or underserved demographics with artificial intelligence.
Oh, thanks so much for sharing those examples, Geralyn. Early in my career, I worked with an eye bank, and so we would, send corneas around the world by plane to do those replacement surgeries, and it's very exciting to hear about how we can use technology now, 20 years later, to really support those preventable diseases. And you've talked a lot about issues around equity and ensuring that everyone has access to care wherever they are in the world, whatever community they live in. And Nanjira, I'd really like to hear your perspective on this. And Jeff had sort of mentioned this idea of making the invisible visible, which is a phrase that I really like. So I think we're all aware algorithms, frontier technologies can risk and do risk reinforcing social inequities. Excuse me. They can be, forces for not so good things. I think we've all seen that in the past years. However, we know that there's also an amazing potential for good. So from your perspective, what must we get right to safeguard equities, especially for these marginalized communities?
Thanks, Hallie. I would say these kinds of conversations are a start, and the composition of this panel, I think, is one way to start getting it right. New normals that are more inclusive in that sense, I think, is a starting point. And really, that's where it sounds simple when we say it, but it's really the complexity of what it means to get right that we really have to contend with. Because at the core of it, how AI is supposed to work is really about getting this versed insight or data, if you want to say ones and zeros, or contexts reduced to ones and zeros to be processed through a particular, let's call it a funnel, and then insights that come out. But what we have to keep in mind at every step of that is that the ones and zeros coming in are diverse contexts. It are realities that I think even in the offline world, are still trying to make sense of, or even create enough spaces to have them shape the conversations or shape what we consider the norm. And so those two things in this day and age now, where we're trying to get let's call it the offline, if it's even still that, right? And in a world where we're introducing technology so quickly, there's the double sort of like, the element that you have to keep an eye out for that's going to be so important going forward. So it's really, even when we say principles like inclusion, what that actually means, it means that if we're saying we're acknowledging that the world is diverse, if making the invisible visible is acknowledging that there is diversity, what does it mean when we say inclusion there? It means we have to realize, if we say we want to introduce AI solutions to a community, how they work for that community is likely to vary to the next community. And the slow work of building the blocks that make sure that these technologies are appropriate and are contextual and serving within the context that they're being introduced. And especially in a sector like health, where we don't have a chance to go back and just course correct and just rewrite code or such. This is people's lives, really. Getting it right might even mean the business models, the ways of working have to fundamentally change. And I think with health and technology is really where we are, is who's going to give room to whom first, in the sense of health practitioners have their own expertise, for example. Techies, in a way, have been told they're the new gods, right? Who's going to listen to whom? And that's a real theater that we're going to have to keep an eye out for. So in the language we use, talk about the promise and potential of technologies like AI and other frontier technologies, the humility we need to introduce to the fact that there are people who are they're experts in their lived experience. There are sectors that have their own experience that need to be listened to, and not just tech disrupting is going to be a very important area to sort of punctuate all these promises we're seeing. Also remembering that no one size will fit all is really where we're going to have to sit with that question about what that really means. We understand it, I guess, on a meta level, but really in practice, it might mean slowing down a lot more. And maybe better to slow it down and get it right, because with health, you're not going to get second chances.
I really appreciate that idea of one size not fitting all. I think as all of us who have tried those t-shirts that supposedly say one size fits all, and you're like, no. It's very rarely the case. I also really appreciated your description of how, the ones and zeros need to be diverse. They need to be inclusive. They need to be representative and provide that perspective of individual and community lived experience. So looking forward, say we do get it right. Say we do figure out how to make sure those ones and zeros are diverse and inclusive and the communities are represented. And we are using AI and frontier tech in its full power for good. And we have all of the sizing, not just the one size for everyone. If that happens, Nanjira, what are the opportunities here? Where do you think the best or biggest or most impactful insights and innovations are that support and advance health equity?
One thing I love about all women panels is the fact that this was already started to be alluded to. So Anne and Geralyn already were getting to it, which I absolutely love. It's, you know, there's one big concern, for example, with AI and what it will mean for employment. But the flip side of it is that we could get it right. We could see business resources being used more efficiently, or even public resources being used more efficiently, to some of the examples we've heard about. And in that sense, you know, you can actually have you know, we can have AI as this helpful assistant to make queries that somebody had to sit there in a thankless job on an 8 to 5, and they can be also, you know, doing more meaningful work. I think we're moving into an era now where human efforts and human skills have to be meaningful, because we are able now to have tools to automate or process these things that, you know, can release our energies and our creativity to other areas. And I think, you know, part of it is even just the dynamism it could bring to even like local economies. You can imagine where there's like a community that's just able to just have this nice self-fulfilling, all these values we talk about, sustainable, because these tools are appropriate helpers. I mean, that would be a beautiful world to live in. And the delivery of public goods and services is another one that has huge potential, and in this case, health being one. And in a, you know, in a world where we're trying to figure out how to best deliver health or education or other public goods, where all the creative energies from private sector, public sector, not-for-profit sector are being put to best use and are being concentrated using all these values. Again, it's really about the terms and conditions that really must apply, but that could really mean something, and making life just better. I think it's just making life easy. I think AI could help us make life easier for people. And lastly, let me say it could really help with strengthening democracy. And let me use two examples there. What AI has a great potential to do right now is with, like, for example, automated translation in places where multiple languages are spoken. You can imagine if, you know, the doctor has come from the city but has gone to a village, but there can be a way through which that is not a barrier anymore, because they're there to help with the cornea transplants, for example, right? That would be a really interesting one. And more importantly, and especially outside of Western democracies, it really could help the participation of democracy to go beyond engaging in the spoken and the written, or rather from the written to allow the spoken. Again, I can come and I can speak in my local language at a, you know, community town hall, and that will be translated, and that makes me valid in that equation. It really could open up new rooms to have these ideals we have about democracy, representation being put to place. But again, it really does come back to them being appropriate helpers. So we do have to make sure we understand how we make sure whenever we talk about AI, the appropriateness of it keeps us, and it could get us there.
Oh, those are such great examples, and I really appreciate thinking about the healthcare worker, and then the recipients of the healthcare themselves at the center of these conversations about. At the end of the day, health is about people. The machines, the ones and zeros, can help those healthcare workers, and they can help them provide better care, but keeping the people front of mind and really looking at how we can make more people whole through the provision of healthcare, I think is such a valuable perspective. So Geralyn, Nanjira talked a little bit about sort of engagement with private sector, and you work at Microsoft. So from your perspective and thinking about the conversation so far, what role and responsibility do you think that the private sector has really in advancing the use of these technologies globally? How can organizations like PATH and Microsoft, or Microsoft and the Novartis Foundation continue to work together to advance care for all and ensure that more people are whole? Oh, you are on mute.
Great question. Thanks for asking. Somebody had to do that once, right? It's interesting. In the tech sector today, there's a ton of talk on bias in AI, right? And a lot of times that starts bleeding into bias in the underlying data, right? Does the data we're using represent, the populations, that we want to gain the insights on? And then there's also a lot of talk around, bias in the software and the algorithms. But one of the areas that's really important to address is a bias, perhaps because of a lack of diversity on the teams, right? And this is where I think it's really exciting when you think about private sector and public sector and nonprofits all coming together, right? So really when you step back in AI, what works is diversity, right? And this isn't just diversity in terms of technology. So it's not, there is an element of that, but it's not the only thing. So it's not just, do I have somebody that understands deep learning and do I have somebody that understands natural language processing? It's so much more than that. It's really diversity of experience on these teams we create. So private sector companies like Microsoft, we can bring deep expertise and thought leadership in software development and data science. We can also bring expertise in things like, operations. Like we run 40 plus data centers around the world and Azure is available in 140 countries, right? So we have experience in this, right? How to scale, how to think about reliability, how to think about security and privacy of all this important healthcare data, right? But where we really reach out to our partners for is this very deep domain expertise, right? When you're using AI in the context of healthcare, you have to have that healthcare domain expertise. So we look to nonprofits like PATH, we look to academic medical centers and research institutes to bring this domain expertise when building and validating the models. And then through local and national partnerships, folks like PATH bring that lived experience that we heard about earlier, right? This firsthand knowledge of the issues and the cultures in which this technology will be delivered. And then they also, through their partnerships, they serve as boots on the ground to then take this rich set of innovation and deliver them to the people.
Fantastic. Thanks so much, Geralyn. And I think it's interesting just these throughputs and themes about representation, inclusion, diverse perspectives, and no one sector, no one person really can do it all, nor should they do it all. And I'm sure, Anne, in working on this Broadband Commission report, Reimagining Global Health Through Artificial Intelligence, you also came across some learnings involving diversity and equity and inclusion. But what else should we be imagining as we're thinking about these new applications for AI, and again to ensure that they are made equitable?
Yeah, thanks, Hallie. And I think many of the elements raised here came also out of the report, and it is really the beauty of the report is that it's so rich in use cases that are impactful, as I said before. But there are like three main messages, and the first one is AI will not necessarily replace humans unless it's really automated tasks that can be done better by a robot, for example, like disinfecting rooms or things like that at the moment. But human intelligence plus artificial intelligence leads to better outcomes. We've seen that throughout all of the examples. So it's the combination of both the machine and the people that makes it happen. The second main message is low and middle income countries have most to gain from a transformation of their health systems with AI, but they also have most to lose if they don't really invest in the things they have to invest in currently. And that is the roadmap towards maturity for AI in health that we distilled out of these insights from all these use cases. We distilled what are the main domain areas or the main investment areas governments should focus on if they want to tap into the potential of data and AI in their health system. And it came to 6 domain areas. All of them equally important, no priority between them, because if you will only invest in one of them, you won't get there. And that's the beauty of it, because first and foremost, governments have to think about the digital capabilities of their populations and their workforces. That's the first element where they have to invest in if they want to tap into that potential. The second one is obviously the infrastructure and the data. Without data, I'm not repeating it because everybody knows it, and it has to be representative quality data to be able to do machine learning on it. But the infrastructure, let me re-emphasize that. 47% of the world is not connected yet. So there is a whole call to all governments in the world to do that investment, because the digital divide has become the new phase of inequity in the world. And we've seen it during COVID. You really have that. It was a question of life and death for many people to reach or to access the necessary care if they were digitally connected. So it is really necessary to build that infrastructure and make sure all countries get connected to broadband and have the capabilities to exploit it. Then the third area is obviously, again, you need the necessary governance, regulatory systems to make sure you keep your people safe, while you don't inhibit innovation too much also. And the fourth one is very important. We've seen through all of the successful initiatives using AI is that they were needs driven. So it is based on a request or a priority needs in the country that the solution was developed, and they are human centered, because if you don't have the user and the people who need it, who will be involved in the design of it, it won't get to scale. So the needs-driven and human-centered design and processes to then integrate the innovation in the health system have to all be thought about before you even start developing the innovation. That's something very important coming out of this report as well, as we've seen a lot of solutions failing because the process to integrate in the health system wasn't there. They didn't think it would cost more work for one or another health professional, and therefore got that resistance. If you don't get the buy-in of the health professionals, it won't work. The fifth one is what Geralyn was mentioning so brilliantly, the partnerships. You cannot do this alone, and any country, none of the countries can do this on their own. They have to work through different disciplines, but with different sectors. Public-private partnerships and the bundling of expertise, like Geralyn was explaining, is absolutely key. But a nice thing here is also very important. It stays a responsibility of the government to keep the coordination of that, to keep an overview of what is going on in their country, so that they know that every solution that gets integrated in the health system does respond to a need or a priority they have defined. Otherwise, they end up with a fragmented landscape, as we saw in so many countries with digital health. So that's key for the government to remain in the driver's seat, to define the needs, and then to work together with the private sector partners and the public sector or civil society whom they need to partner with. And lastly, obviously, if there's not enough financing for integrating AI as an integral part of a health system, the governments have to open up for innovative ways of financing this. Whether it's innovative ways of incentivizing innovation or innovative ways of monetizing data and their assets, the governments have to come up with solutions that they can tap into AI innovations. Otherwise, they stay behind and are losing. While now, low and middle income settings don't have the legacy systems that we face. We have to get rid of stuff to make sure that our data becomes interoperable in our high income countries, where if you don't have that, you can leapfrog and be much faster in integrating AI. So these were the main learnings of our report. And I would really like to invite you all to have a look at it. It's gonna be a living report. We translate it in a self-assessment for government of where they stand on each of these 6 domains qua maturity, so that they can also see where they have to invest in more than and where less, so that we can always improve this tool.
Oh, that's fantastic, Anne. I love the idea of a living report. I think that that's so important, and I expect that my colleagues will make sure to copy the link to the report and put it in the chat so everyone can take a look.
Yeah, I sent it through in the chat, but I think I sent it to you. But I guess path will transfer.
We'll make sure everyone gets it. And I think we're all also reassured that you're not imagining a future where the robots take over everything. So thank you. So thank you for that. And I also really just appreciated, this conversation around bundling expertise and experience and ensuring that that the individuals that are responsible for sustaining the systems and are most deeply impacted by the systems are actually driving the development of those systems. And that leads us into the first audience question that has been sent through, all around really keeping people at the center, which I think has also been the center of our conversation so far. We've talked about ensuring that patients and health workers have access to the benefit of these frontier technologies, but how do we think about engaging communities in the development of AI and frontier technologies? So not just being impacted by them, but actually supporting the development of them. And Geralyn, I know that Microsoft is doing a little bit in this space through some of your engineering centers. So I'd love your perspective on this, and then Nanjira and Anne would love for you to weigh in as well.
Yeah, that's a great question. And I would almost take this to sort of the citizen science angle. Right, we've seen exciting work on a number of projects, some of which intersect directly with the artificial intelligence area, where we've had communities of people who come together to do things like what we call in data science, data labeling, where they're actually working to, through a guided experience, put labels on the data so that models can train. We had a wonderful experience with people doing some data labeling with blood flow and mouse brains for Alzheimer's, and some data labeling for images of unsafe sleep positions for sudden infant death syndrome. So it's really about engaging people who want to help and letting them be a part of the process and the experience of artificial intelligence. I also think that there's other examples, like even in COVID, of the way that people have been involved. One of our partners that we worked closely with on the COVID is a gentleman, Dr. Greg Bowman from WashU in St. Louis, and his team is doing protein folding, which is a really computationally intense process where you learn about the structure of the COVID protein, right, of the virus protein. His team not only uses massive cloud compute power, but they have this but it's almost like a SETI-like experience where people can come in and run this protein folding algorithm on their computers. And so that is a way that people can be involved from a technology standpoint. There's also, I think, way that people can be involved, and that's from just, roughly contribution of ideas and being a part of discussions like this. Like everybody who showed up today is listening to this is a part of this experience, and I think that's so valuable.
Oh, that's great. And Nanjira, I'd love your perspective as well. I know that you used to work at the iHub in Nairobi, which I've been there several times, and there's such energy and engagement there, especially in some of the groups of young women and girls that are coming together to really engage around tech and tech and data. So how would you, what do you think about this question about how we can get communities better engaging in the development of AI rather than just being the recipient?
Yeah, I mean, I guess it's almost a chicken and egg question. Who needs to reach out to whom? Communities are organizing, whether or not we're part of that conversation. Much in the same way, if we think people or processes or places are invisible, they are visible to themselves. So it's always who needs to reach out to whom. And much, if you really want to have an interesting, thought experiment to these issues, is really going away from the tech and just think about it in the real world. Even with communities we built in places like iHub, they fit for a moment and in a time, and for every iteration of either technology or communities, because we can't say for the first wave of people who were online, they were representative. And made a very good point. Till today, actually only more than half of the world's population is connected. So if we are relying on those platforms, for example, to create community, we are overlooking another 50%. So it's really keeping a present continuous curiosity, if you will, about who needs to be involved. Actually, who is not involved? Even in this conversation, again, there's 154 of us on this call. Who are we representing? But more importantly, who is not? And so how do we make sure in our next iteration, we keep bringing more people? We always know who these people are. That's how we build communities. You always know you can bring one more person. You always know you can bring in, one more representative. And it's really making it a present continuous thing other than a tick box measure, which will make it something that is embedded in practice over and above being a sort of like a virtue we want to keep signaling at.
I love that idea of considering who's not involved, and of course moving away from tick boxes, and that sense of tokenism, and we're just sort of going down our list of demographics to make sure that everyone, all of those different groups are represented. That idea of who isn't participating and why aren't they participating, and really diving into that sort of a conversation. I think that's a really powerful framework that I will commit to adopting, and hope everyone else listening in will as well. So, Anne, another question has come in that I would really like your perspective on. We talked a lot about sort of the enabling environment, sort of necessary to really advance AI and frontier tech. So let's say we get all of these pieces and parts in place. How does that change what healthcare looks like globally? What is that difference looking, 5 years, 10 years down the road without the robots doing everything for us? But what does that look like if this future that you've described in this report actually comes to bear?
Well, you asked me a very, very difficult question. I don't have a crystal ball, but I can see that AI offers tremendous opportunity to build, as Geralyn was saying in the beginning too, real health systems, so that we keep people longer healthy. And we know that we are growing in the world up to 10 billion, I believe, by 2100. That's the max of the population we will see. But people will grow older and older and have to live longer healthy. Otherwise, it becomes an even more unbearable charge on our health systems. So we need to keep people mobile, to keep people independent, to keep people aware of what they can do to manage their own health. And what is a better tool than AI, that they know, okay, if you are a heart failure patient, for example, and you have a sudden gain of weight, my risk of getting back to hospital is 50%. So I have to know that myself, your risk factors. You can really predict who in the populations, if you look at from a population level or a policymaker, decision maker, the highest risk for the acute events, for example. And why would I have to invest my scarce resources more in these population groups than spend it over the whole population? Because you can predict better who is at risk. And there's fantastic examples like that. In India, Apollo Hospitals is one of our partners in the data collaborative we have with AI for Health in Microsoft also. And they drilled down 300 indicators to 40, then 7 simple indicators that don't even involve a lab and can predict someone. So I mean, if decision makers or health system managers have this kind of tools, not only can your health professionals deliver better quality of care, and that's urgently needed, but you can also deliver better health system management, because you know where to spend your resources. We know that most of the people in the world die of a low quality of care, much more than of a lack of access to care. So we say digital is the means to increase access, but for me, AI and the human plus the machine again, is the means to deliver better quality of care. Simple decision support systems have tremendous impact on how patients are managed. And that is the goal of all of us working in global health, I believe.
I think that that's a fantastic vision. And again, we're bundling more expertise. We're bundling the expertise of all of our communities and different subject matter perspectives, along with the value of those predictive analytics that the machines and the algorithms can offer to allow us each to have a little bit more control over our health and awareness of our health activities. That's really exciting. So as we're sort of running up to the top of the hour, I have one final question that I'd love for all of you to respond to. And Geralyn, we'll start with you. Will AI and other frontier technologies be a net positive or a net negative for health? Geralyn?
That's a great question. So I want to start by saying it's really early days for AI, right? I'm reminded of the early days of software engineering. You know, you use assembly language, you load some data into a register, shift left. Okay, so that's a little bit of a tech joke here. It's really not that early, but it's still, we have a lot to learn, right? And when you're in this kind of learning phase, I think it's important to remember a couple things. The first thing is really, this is all about diverse and inclusive design, right? Bringing people together, because AI only works when we are inclusive. That is the only way that this will work. We also need to be really humble, right? And you know, one of the things that I think is so exciting about AI is that it empowers choice. It empowers choice for the people who are on the receiving end. But we always have to respect that choice, right? I also think we need to think about things like literacy in this space, right? Making sure that people, you know, on the kind of the research side, when they're consenting to let people use their data, they understand what that consent means. And then when they're faced with, you know, a decision guided by AI, they understand the ramifications of that decision, right? And so I think really making sure that people have that choice and they understand those choices is really important as well. And then, you know, I also think we just need to be humble overall about what AI can and cannot do, and remember that, you know, in these early days, you know, AI assisted technology is just a place where we can go and leapfrog. So just stepping way back, you know, when I think about just the group of people that is here on the panel today, I'm excited because this is really diversity of opinion. It's, you know, different sectors represented. My hope is that we can continue these kind of conversations because they lay the foundation for the future.
Fantastic. Thank you for that perspective, Geralyn. And I've written down humble with a big box around it. I think that that's just an important word for us all to focus on, not just, you know, in regard to AI and health, but probably just in a general, like, good value for contributing to our individual communities. So thank you for raising that up. Nanjira, what's your perspective? Overall, net positive or net negative?
Like, as you can see, no one is willing to answer that. But building on Geralyn's point about humility, I think we're going to have to think about how those right now in the know, the builders of these systems that are going to be AI eyes. I mean, we're living now in a moment where analog and digital are blurring. We're just going to be talking about this new world. How we can have those in that system, because it's a power question, it's a resource question, it's an expertise question, how we can bring the humility for them to think of themselves as servants to a world that's diverse, that has really weird complications around it, is going to be just as important as getting, you know, somebody like Pavitra in the chat there, who has expertise as a healthcare practitioner, to know that that knowledge is enough. Literacy is not just about always learning. It's also about how that knowledge can be put to use. So how can they be brought in to help build these worlds? Because if we're saying AI is, we can think of it as bringing another opportunity to get all these ideas of representation and you know, democracy, if you want to call it that, right, or very wrong. It really is going to come back down to how we really work on these things beyond just calling them out. I think we've done a good job of calling out what's good, what's possibly bad. It's really about what the real theater of making them happen is going to be something we need to bring to the conversations more and more. So we do need to converse more. We do need to move fast and then wait, but also while we're waiting, let's be making sure that it's trying to make sure we've got everyone on board, everything on board before moving to the next one. And lastly, I'd say, I think it will all come down to whether we can shed the notions that there are some people who can build for the rest of the world because we've told them that the geniuses that were born to live and tell us what we can and cannot do. That is going, I think, to be the real determinant about whether it's a net positive or negative. So it's a net complicated.
I like that. I like that. I'll add that to my list of t-shirt slogans. It's a net complicated. And I also appreciate this idea of that you've been noting in the chat around contextualizing experience of the healthcare workers, of the community members. Like again, it's this bundled expertise that is really essential, even in this net complicated space. So that's great. So Anne, so what do you think? Net complicated, net positive, net negative?
As I'm a born optimist, I am very positive. Yes, absolutely. I think with the challenges we have in the world and the shortage of skilled health professionals everywhere in low and middle income countries, the rapid urbanization with absolutely insufficient infrastructure whatsoever to address the needs of all these people living in the cities or coming to the cities, all the burdens and the constant threats of new diseases. We cannot handle it with the health systems we have today. So we have to change them, to change the way we deliver health and care. And I think looking at the Scandinavian countries that are the example of AI integration in health, if I may, and they have put the people at the center, and they do manage health in a very different way and bring it very much out of the brick and mortar of the health system. That's what it's going to help us to do, AI. So we have to look at those examples, but it's not going to be easy to apply that everywhere, because the biggest stumbling block for applying such a beautiful model that can work in a Scandinavian country is the place where you will do it. If there is no trust in your government, even in the UK, it's currently not possible to apply those things from Scandinavia because the government is not trusted, or in many other European countries. So you need that. If you want to deliver precision health and care, you need to have your population trusting you, because otherwise it won't work. But I think we need to believe that it's gonna be a game changer, a transformation power for our health systems, as we don't have anything else that currently has that gives that opportunity for making our health systems truly health systems. To repeat myself again, but I'm really believing that it's possible.
Thanks so much, Anne. I mean, so it sounds like we are all optimistic. We think that there's tremendous positive potential, but it's going to take a lot of work, and it's going to require all of us, and it's going to require all of us to think a little bit differently and really to focus on engaging everyone, and through that, we will be able to move forward and really actualizing the potential of frontier technology. So unfortunately, I mean, Geralyn's right. We could spend days, and I sort of want to now spend days talking about this, but we are out of time. And I just want to again express my gratitude and appreciation to these amazing women, these amazing scholars and scientists and activists for sharing your time and perspective with us today. It was so wonderful to hear from all of you on what is happening locally in your communities and globally around frontier technologies in health. For those of you tuning in, thank you for your participation and thoughtful questions. I've enjoyed seeing the chat. And while we weren't able to get to all of your questions, we hope that you will continue to engage with us on our social platforms and keep this conversation going. And whether PATH is new to you or you followed us for a long time, we really do appreciate you taking the time to join us today. Please stay in touch, and that we hope that you will log in for a future PATH Live Forum event. Thank you, everyone. Take good care.